This next slide, you can just fit this information in somewhere there on page 160, looks at a slice of the spinal cord. If you take a cross-section of that part of your spinal cord called the sacral segment, right? Just a thin slice sideways, you'll find it looks like this. I hope this also reminds you of a figure we talked about when we covered the topic of pain. You recall? All right? When we talked of pain, we talked about the spinal cord, the dorsal horns of the spinal cord. Well, these are the dorsal horns. Again, we revisit here. This is gray matter, white matter around it. Dorsal horns are pointing to the back, ventral to the front. So that's a thin slice of your spinal cord. Now, what you find, interestingly, is that this is where most of the control of sexual arousal is going on. It's not at the brain. It's not at the upper levels of the spinal cord. It's actually right near the tip of the spinal cord where all this control is going on. And this is how it works. You have G for genitals, and let's say there is some kind of physical stimulation, or what we call tactile stimulation of the genitalia in either males or females, doesn't matter. What's going to happen is you're going to have an impulse, a sensory impulse going to the spinal cord, going to the sacral region of the spinal cord, right? Through what are called afferent fibers. You all remember that term? It's also spelled out in an earlier diagram. Afferent fibers. So genitals get stimulated tactually. Impulses then go back to the spinal cord saying, yeah, genitals are being stimulated. And interestingly, spinal cord responds with efferent, through an efferent pathway going back to the genitals saying registered. And on it goes. That's all. It's a simple reflex arc. Afferent